Folks, in case you didn't know, heart disease is still the leading cause of death for men and women. It's kind of hard to believe because we've been hearing about that for years. And in case you're not aware of that, you want to listen to this segment because we're going to be talking about exactly what heart disease is and how you can keep it from happening to you or a loved one. And joining me today to talk about that is Dr. Fayaz Malik. He is with St. Thomas in Rutherford County. So nice to have you here with us.
Thank you for having me.
He's a cardiologist who's been here for several months now, and we welcome you to the community as well.
Thank you so much. Appreciate it.
For folks who don't know what heart disease is, Dr. Malik, go ahead and explain exactly, because people might confuse it with something else related to the heart.
Sure. So heart disease, I mean, obviously that's a big category, but I think classically when you say heart disease, people think of the thing that's going to give you a heart attack, the blockage in the artery.
True.
But there's a whole lot of other things that cause heart disease. So valve problems, the lining of the heart can be a problem, electrical things like arrhythmias, palpitations, things like that. And any of those things can also result in the heart failing. So heart failure is a word we also use for, you know, it's lumped into that heart disease category. And then there's just diseases of the heart itself, the heart muscle, and sometimes people are just born with those conditions.
So for folks out there who are aging and wanting to keep, you know, in good health, what are some of the risk factors they should be aware of when we're talking about specifically heart disease?
Sure. I like to lump those into those you can control and those you can't do anything about.
Okay.
So obviously, you know, just normal aging, we can't do anything about getting older. So
too bad, huh?
Yeah, I know. The older we get, the more we're prone to heart disease. Being male, the testosterone effect, the Y chromosome, we know that people are higher risk if you're male. And there's genetic aspects to it. If you have a family history of heart disease, premature heart disease, you're going to be more prone to it. Can't do much about those things, but then there's a whole host of things you can do something about, smoking being the big one.
Sure.
But cholesterol, blood pressure, exercise, weight, all these other kind of things are risk factors that we can do something about, diabetes.
And those are things also that doctors, when you go to visit with your cardiologist or even your, you know, general doctor, you go in and get a physical, there's certain kind of testing that you go through at certain ages. Talk about some of those screenings or some of those tests that you might run on a certain patient who might be prone to heart disease.
Sure. So, I mean, when you go to your primary care doctor, they're typically going to check your blood pressure, and oftentimes they'll get labs and see what your cholesterol is to kind of get a baseline assessment. Are you at risk for diabetes? Do you have high blood pressure? Do you smoke? They'll do these screening questions. But you usually don't do screening cardiac imaging unless there's something else to prompt you to by way of symptoms. But those are the basic things that people should have, for sure. Okay.
Something also that you might get during a physical is a cholesterol test.
Sure.
And especially if you have family history, as you were talking about, or there's a genetic, you know, predisposition of some sort for heart disease. You'll get this cholesterol, you know, test, and you get numbers back. And you have to be able to read those. Obviously, you're going to have a conversation with your patient about that. But how important are those numbers that you get back?
Sure. So, you know, that goes into that category of things you can control and things you can't. And so genetically, some of us are more prone to having abnormal and bad cholesterol numbers. So we can't do much about that genetic predisposition. But your doctor will look at that profile. There's a set of numbers you get and kind of gauge what are your risks. And then we'll counsel you about, you know, whether or not you need to be on medications or can you just control this with diet, those kind of things. But there's good cholesterol, there's bad cholesterol, there's triglycerides, all these kind of things that factor into what that profile looks like.
Okay, and is there a certain number that you can give out to folks who should be aware of when you get those results, what you're looking at? What is the, you know, good health cholesterol number that we should all kind of hover around and pay attention to?
So in general, your total cholesterol, you want it to be lower than 200, the total cholesterol.
Okay.
Yeah. Your triglycerides, the fats in your blood, if you will, you want that to be less than 150 or so.
Okay.
And in your bad cholesterol, the LDL, and I like to remember that as L for low, you want that low.
Yes, that's
so
good.
Ideally below 130. 160 certainly should get people's attention if you're in that range. And then your HDL, H for high, you want that as high as possible because that's the good stuff. You want that above 40 and closer to 60 would be nicer. And so that's actually in the cardiac protective range if you get HDLs above 60.
And some things that people can keep in mind in terms of, you know, combating high cholesterol and especially the bad kind. you know, you can help it out by exercising, right?
Absolutely.
And a certain diet. What would you recommend as far as that's concerned?
Yeah, watching the carbs.
Okay.
Those get processed into the fats. You know, looking at labels, seeing, you know, where there are the saturated fats, trying to limit those kind of things. The cholesterol on the labels is usually a good guideline. But you know, exercise is a big part of that too, and trying to maintain as close to your ideal body weight as possible. And that can lower your cholesterol substantially, and that's part of those things that you can control, even if you have a genetic, you know, predisposition there.
And obviously you're going to have a conversation at some point with your doctor if your levels are still a little bit high and you're doing those kind of things and trying to make yourself healthy, and obviously you know, it's not going down. So at some point maybe medicine is in your future. Do you all?
Yes, absolutely. If you look at the profile of a patient and if they fall into a category that's high risk, and they're doing all of these things, then sometimes you have to put them on medications to get to that target goal. And you know, we've heard of these drugs. They're called statins, those kind of things. And you know, the data is pretty good on these medications, that it does really lower your risks.
Yeah, and that could be for a lifetime.
Correct. Yeah,
all right. Yeah. So cholesterol is important, but also blood pressure when we're talking about heart disease. It's something else that you have to pay attention to when you have that conversation with your doctor. You need to make sure you know what your blood pressure is and what you can do to help that as well. Right.
Sodium, public enemy #1. So that's really watching where the salt is. That's a big part of just the general treatment of blood pressure. But checking it at home, at rest, and you know, if you need medications, again, there's a genetic predisposition here as well. If your pressures are high, getting on the appropriate medicines to bring it down.
You know, for folks out there, Dr. Malik, who don't think that this conversation may apply to them, what would you say in terms of just giving advice? At what point we need to be paying attention to these kind of things in our, you know, yearly physical and whatnot? I mean, how old should somebody be? Is it when you start a family, or when?
Well, traditionally we used to think, oh, you know, you're getting into your 30s or 40s, you start thinking of heart. But now the thinking is that it's never too late to start thinking about it. I mean, we know that plaque starts forming in arteries even when we're in our adolescent years, and these days we're seeing folks who are becoming more sedentary. So you're seeing children with childhood obesity rates that are high, and you know, they're not out there playing, and so they're inside video games, and their cholesterol numbers are rising. The incidence of premature coronary disease is rising, and you're seeing folks smoke still, even at earlier ages, and the vaping phenomenon, the e-cigarettes, right? So you're seeing young folks being exposed to nicotine at earlier ages than perhaps they should be, and so all of those create risk for you, and it's the long-term risk. It's over time. So I don't think it's ever too late to start. I think it's, you know, it can't be, you know, you should be exercising and out there and doing things regularly, even at young ages. Yeah, and don't damage your body when you're young to where you have complications, obviously, when you're getting a little bit older. That's right. And all of those tobacco products and the vaping, I mean, as a cardiologist, you're going to say, don't even go there. Don't even go there. Don't even start, because then nicotine is bad. It's, you know, if you quit smoking, if you're a smoker and you quit smoking, and you stay off of cigarettes for 1 year, you've cut your risk of heart disease by 50%. Wow. So it's a huge risk reduction. So again, it's never too late to quit smoking, but don't ever start. You know, can you tell me quickly just signs and symptoms of cardiovascular disease as well? Sure. So when we think of the classic heart attack thing, it's the chest pain. And what you're wanting to look for here is pain with exertion. So if you're doing something that you normally could have done and now it's causing discomfort in the chest, that should be something you certainly bring to your doctor's attention, especially if it's associated with breathing difficulties or heart racing or other types of symptoms. But remember, as we get older, people that are diabetics and women also present more atypically than men. So it may not always be that classic chest pain. It could just be fatigue, that the thing that you could have done before, now you're just more tired than you should feel like you are. Sure. And again, those kind of things might be something you want to bring to the attention of your doctor, or unexplained swelling in your legs, things like that. So much good information to pay attention to. Hopefully everybody does. All right, cardiologist over at St. Thomas in Rutherford County, Dr. Malik. Thank you so much for your time. So nice to meet you.